Hi students, welcome back to TAT 5000. It's me again, Dr. Dumi Mahlangu. Thank you for tuning in. I hope you guys are still watching the videos, okay? They look long on YouTube, but if you stack them up together, they amount to like an hour each. So, I mean, yeah, please watch, okay? So, this week we'll basically be discussing orthodontics, which is literally my favorite, speciality. Please download everything under, I think, Unit 15 under TAT 5000. The presentation I'll be using this week is Dr. Oosthuizen's one. So please do not, don't follow Cengage. We're now using Dr. Oosthuizen's one. I went through it. I feel like it makes more sense as opposed to that other one. But if the other one has information that I feel is pertinent to you guys, then I'll just discuss it as well, because we have quite a few things to go through, because under orthodontics there's even like tracing methods, there's even instruments, so we still have to do that. So I hope to fly through this presentation, and then from there, what I think you guys really need to know, like the gist is, what is orthodontics, the different types of orthodontics, being preventative, interceptive, as well as specialized, the instruments that they use in orthodontics, the post-op instructions that you will be expected to give for orthodontic patients, and the types of materials that you are expected to know for orthodontics. So that's basically, if you know that, you know what is expected of you, and we are happy campus now. So basically, orthodontics, according to this slide, is the speciality of dentistry concerned with the supervision, guidance, and correction of the growing and mature dentofacial structure. So what that slide is basically telling you is orthodontics is basically concerned with a patient, particularly young patients, but even in adult patients, where we try and correct any dentofacial discrepancies or anomalies. So be it we're trying to correct a skeletal problem, so a problem with one's bones that are causing issues in the mouth, or the teeth themselves being maybe not positioned correctly, that we try and align, or even a bit of both actually, so we can correct things skeletal, on a skeletal level as well as on a dental level. So that's basically what that slide is trying to explain to you. So we basically try to monitor, we try to correct, and then we try to maintain what we've corrected, either skeletally, so be it your maxilla or your mandible, their growth directions, or the teeth themselves, depending on what we find based on our analysis. So they then describe a malocclusion. So a malocclusion is an abnormal or malpositioned relationship of the maxillary teeth to the mandibular teeth when occluded. So basically, like they're saying, it's just a relationship where now you ask a patient to bite, and then we note any and all discrepancies between the maxillary teeth as well as the mandibular teeth. So that relationship is what we essentially, if there are any problems, we consider it a malocclusion. So a malocclusion, ladies and gentlemen, it can be a tooth, it can be a group of teeth, it can be the entire arc, or it can even be both arcs. It just depends on how bad the situation is, okay? So causes of malocclusion. Malocclusions basically have developmental causes, genetic causes, as well as environmental causes. So with the developmental causes, they highlighted things such as congenitally missing teeth. So that would normally be like your lateral incisors. They tend to be missing in quite a large number of the population. So that space where the lateral incisors were supposed to be can actually cause a multitude of problems in the arc itself. Malformed teeth, such as peg-shaped lateral incisors as well. So because now we have teeth that are malformed, they then cause like a malocclusion. They cause a problem within the arc, or the relationship of the arcs with one another. Supernumerary teeth, so that's basically patients who have now an additional number of teeth. So you can imagine, obviously, if you have now more teeth than your mouth can accommodate, that can actually cause crowding in one or both of your arcs, that then creates a space issue, okay? And then interference with eruption. So sometimes in some patients, you'll have situations where they don't necessarily follow the norm, in that maybe we might be expecting maybe teeth to erupt, and then teeth don't erupt. Sometimes teeth can be impacted such as, maxillary canines, even mandibular premolars, for example. So that inability to erupt or now even over-retained teeth now cause an issue for the surrounding teeth to actually erupt and sit properly and be aligned properly within the arcs, as well as then ectopic eruption. Ectopic eruption, ladies and gentlemen, is basically when a tooth erupts outside of its normal position or away from its normal position within an arc. So that's when you'll find maybe teeth that that erupt into the palate or lingually in the direction of the tongue, things like that. Yeah, that's basically known as an ectopic eruption. So you are out of the position that we expect you to be in. So trying to accommodate that, then causes an issue. Then genetic causes, they talk about discrepancies in the size of the jaw and or the size of the teeth. So normally people who suffer from malocclusions, ladies and gentlemen, there is a family history of, if I can say, skewed teeth or bad teeth, or a malocclusion in the family. So sometimes, like they say, it can either be like a problem skeletally, or it can either be a dental problem, or even a bit of both, like I had explained to you guys before. So when I talk about skeletally, I'm talking about situations where maybe the arc is maybe too narrow or is not growing as fast as we would like it to be, or the growth direction is not necessarily favorable. So sometimes instead of growing horizontally, for example, you'll have a patient that is growing vertically. So that is basically causing the malocclusion. So what I'm describing can take place either in the maxilla or mandible, or sometimes when both now jaws are now either growing excessively or not growing at all, or the actual shape or structure is not conducive for the teeth that the patient has. And then from there they talk about and or the size of the teeth. So now we've discussed, like I'm saying, if the teeth are malformed, so they have like a different shape, like your peg-shaped laterals, you have situations where patients have large teeth that the jaw itself cannot necessarily accommodate, or sometimes when patients have small teeth, so microdontia in this case, so small teeth that now the patient has excess space in the jaw, and we need to correct that accordingly. From there, they discuss environmental causes such as birth injuries, fetal molding, as well as trauma. So trauma is especially very common. Now, kids are playing, then someone falls over, they now lose teeth. So let's say as a result of then losing teeth, we then have a space discrepancy in one or both of the jaws. So we're discussing things to that effect. So those are some of the environmental causes that can actually result in a malocclusion. From there, the slide then talks about habits, so such as tongue thrusting, right? And then tongue thrust when swallowing, right? And then from there, we have our thumb and our finger suckers, as well as bruxism. So obviously that friction that they cause with the teeth, obviously then causes a loss of tooth structure, especially enamel structure. So now then the loss of enamel structure or tooth structure then affects the situation in the oral cavity. And then as well with then mouth breathers. So mouth breathers, obviously they're breathing with their mouth, so then this can cause like a narrowing of the palate, a deepening of the palate, increased susceptibility to caries. So obviously if there's increased susceptibility to caries, it may result in either one, plaque, two, early loss of teeth, which would then affect the space situation in one or both of the dental arcs. Okay, so malocclusion. So this slide is basically asking, what is malocclusion? So a malocclusion, ladies and gentlemen, is any deviation from a class 1 occlusion that is then considered to be malocclusion. Okay, so from there you're probably asking yourself, like, what is a class 1 malocclusion? So we're going to touch on that very quickly. So ladies and gentlemen, there was a very famous person by the name of Engel. This person basically created a classification on how we can classify teeth in the different classes, so that then we can know how to address their issues, come up with proper treatment plans and things to that effect. Okay, so with Dr. Engel's classification, Basically, a class 1 occlusion is when the distal buccal cusp of the first permanent molar occludes in the buccal groove of our first permanent mandibular molar. Do you guys hear that? So the mesiobuccal cusp of our first permanent maxillary molar occludes in the buccal groove of our first permanent mandibular molar. That is then considered a class 1 occlusion. Anything that deviates from that basically is considered malocclusion. So basically, it is that relationship, as well as then a 2 millimeter overjet is then considered. Then from there, ladies and gentlemen, we have a class 2 malocclusion, Dr. Engel's class 2 malocclusion, also known as a distal occlusion. Okay, in this situation, the buccal groove of our first permanent mandibular molar is then distal to the mesiobuccal cusp of our first permanent maxillary molar. Does that make sense? So our buccal groove is then distal, yes, distal to the mesiobuccal cusp of our first permanent molar. That's basically what happens in a class 2 malocclusion. And then in a class 3 malocclusion, ladies and gentlemen, that same mesiobuccal cusp of our first permanent molar in the mandible is then mesial to the mesiobuccal cusp of our first permanent maxillary molar. I hope you guys understood that. So in a class 2 malocclusion, it will appear as though basically like the maxillary anteriors are like far ahead of the mandibular anterior teeth. Okay, and then in a class 3 malocclusion, it will look like the mandibular anterior teeth are now far ahead or in front of the maxillary anterior teeth. Okay, so that's basically what happens in a class 3 malocclusion. Okay.